Today we are doing a presentation on Patricia and the clinical wisdom in nursing practice. We wanted to start off this presentation by showing a famous quote that she had. It says, "Nurses spend years in training to learn the science, but they spend a lifetime learning the art of nursing." And we thought this was very important and connected to us because it shows that you don't just learn nursing in school. It's not just what the textbook says, it's everything that you learn, and you can learn day to day. You always continue to grow in nursing. So who was Patricia Benner? She was born in 1942 in Virginia. She obtained 3 degrees. She has a Bachelor's of Arts in Nursing, a Master's of Science in Medical Surg Nursing, and a PhD in Stress Coping and Health. She worked in being a registered nurse for years, and then she decided that she wanted to educate young nurses. So that's where she taught at the University of California, Berkeley in UCSF. She taught and mentored countless student nurses and reminded them that nursing knowledge does not only come from what they learn in school, but also in their clinical settings. She is a well-known author, nurse theorist, and educator, but she is best known for her famous work, Novice to Expert, Excellent in Power in Clinical Nursing Practice, which was published in 1984. This is where she says that her 6 aspects of nursing, 6 stages of nursing mastery. And these are her 6 aspects: reasoning and transition, skilled know-how, response-based practice, agency, perceptual acuity, links between nursing, and ethical reasoning.
So I'm going to be touching further on Benner's 6 aspects of clinical judgment and skilled comportment. So the 6 aspects of clinical judgment blends perception, ethics, and action as a guideline to ensure the best practice of a nurse. These guidelines involve the traits of reasoning, knowledge, and expectations. So the 6 aspects, number 1 is reasoning and transition, and this touches on practical reasoning. So this is your decision-making skills as a nurse, your reasoning skills as a nurse for each patient outcome. So number 2 is skilled know-how, what to do, when to do it, how to do it. So this is for every patient that you'll encounter. You have to have a game plan, you have to know what to do, when to do it, how to do it, so that you have the best outcome for your patient. So number 3 is response-based practice. This is the adaptation to meet expectations. Every patient is going to be different culturally, physically, so you have to be able to adapt as a nurse to make sure that every patient has the best care possible. So number 4 is agency. This is the ability to act in or influence a situation. So this is you being able to take every situation you're in and have the most effective skills, the most effective mindset, and have the most effective influence situation to situation. So number 5 is perceptual acuity and skill of involvement. This is your engagement and involvement with each patient. You want to be active in their plan of health and consistently helping them through their healthcare journey. So number 6, lastly, is links between clinical and ethical reasoning. This is ethical notions of good outcomes. You want to have the most ethical plan of care for each patient so that they have the best outcome possible no matter the patient.
I'm going to be talking about Benner's meta-paradigm concepts, which includes person, which is the individual patient that is living in the world who is growing and changing through life experiences, and not someone with just a fixed definition. The second is environment, which is the social world around the person, which also gives meaning to their experiences. Next is health, which is the human experience of health or wholeness, which includes like their understanding of the overall experience or well-being or wholeness. And then nursing overall is their caring relationship, where the nurse helps the patient through their illness, health challenges, and their life experiences. And then Benner uses these ideas in the nursing process, which includes assessment and planning, which is where the nurse and the patient come together and develop a plan. And then implementation is where the care is carried out through skill, practice, and judgment. And then lastly is evaluation, when the nurse and the patient come together and see if this care plan has worked for this patient's unique situation.